With the emergence and the re-emergence of pathogens here and there, diseases know no border. We are more interconnected than ever before due to globalization. And because of that, diseases are just an airplane away or a footpath away, which makes a health threat anywhere a threat to health everywhere. So, to promote and safeguard public health, every country is required to have an effective field epidemiology capacity. And the Global Health Security Agenda calls for 1 trained field epidemiologist to 200,000 people in a nation to detect, to respond to, and to contain public health emergencies. And field epidemiology is commonly known as shoe leather epidemiology because field epidemiologists are to walk the last mile to ensure that public health emergencies are responded to and contained, ensuring a safer community for all. And we are glad to be a part of this network of disease detectives that are striving to make this world a better place.
I have always dreamed of being actively engaged with communities. Liberia Field Epidemiology Training Program did not just equip me with tools on interacting with communities, but it has also taught me to detect, report, and respond to events of public health concern.
It's an honor to be a field epidemiologist. In the field epidemiology training program, I have built my capacity in disease surveillance and response.
Field epidemiology is not just about investigating outbreaks, but it's also about reporting evidence-based information for decision making.
As a field epidemiologist, we are involved in all pillars of public health preparedness and response, from coordination to surveillance to operation.
As a cohort, we conducted several outbreak investigations, including the suspected chemical spillage in Grand Cape Mount County and measles and Lassa fever in Montserrado, Grand Bassa, and Bonk counties in Liberia. We also conducted a study to assess the knowledge and acceptance of the human papillomavirus vaccine among caregivers of adolescent girls 9 to 14 years in Montserrado County, Liberia. And from our findings, 3 themes emerged. The knowledge of the HPV vaccine among caregivers were very low, and despite the population at risk, the uptake of the vaccine among adolescent girls were also low, which was significantly associated with the knowledge of the vaccine. However, after our interviews, we carried out awareness, and surprisingly, the caregivers were willing to allow their girl child to get vaccinated with or without subsidy. Therefore, we recommended to the Ministry of Health and other partners of the health sector to improve strategies towards immunization, especially with the human papillomavirus vaccine.
We are the boots on the ground for a better health.
Let's maintain the gains by expanding our footprints across the world.
I am here wishing all my fellow field epidemiologists a happy Epidemiologist Day.
Happy World Field Epidemiology.
Happy World Field Epidemiology Day.
Happy World Field Epidemiology Day.
Happy World Field Epidemiology Day from the 6th cohort of the Intermediate